a question and answer portion at the end of the webinar, so please type your questions in the question box on the right-hand side of your screen, and we'll get to them individually in the order that they come in. I'd like to now turn things over to Roan Carr of DocuVault and Matt Smith of AOS.
Welcome, ladies and gentlemen. My name is Roan Carr with DocuVault, and on behalf of my partner, Matt Smith, we'd like to welcome you to the Document Security and Your Practice webinar. This is going to pertain to the red flag rule that applies to you. DocuVault is a full-service business archive that provides four main services: confidential document storage, secure shredding, document scanning, and electronic hardware destruction. Our written policies and procedures address all vulnerabilities related to preventing, detecting, and responding to reasonable and/or foreseeable risk of identity theft. Our contracts and our terms of service acknowledge our responsibilities related to preventing, detecting, and responding to reasonable and/or foreseeable risk of identity theft. We encourage customers to conduct their required annual review of our security as well as our compliance to our published policies and procedures.
Good afternoon, ladies and gentlemen. Matt Smith with AOS. My company has grown to provide the latest in hardware and service as well as software to help businesses operate in the most efficient and cost-effective way possible. Specifically, healthcare providers work with AOS to help improve efficiency, reduce operational costs, and reduce risks associated with their data and document-intensive business processes. Healthcare executives with a vision to streamline and standardize their business processes have utilized AOS's expertise to assist with the design and implementation of software solutions to help them attain their process improvement and/or meaningful use initiatives. Today, during our webinar, we're going to talk about documents to keep them secure regardless of if they are in paper or electronic format. Kind of each of us have our own role within that and why we partner so well together. When a document becomes paper, it goes through a process, and Roan and DocuVault handles that part really exceptionally well. AOS intends to handle that document from inception, whether it's the hardware that prints it or scans it, and then track that electronically throughout some of our document management softwares. The questions that will be addressed today are, keep documents secure regardless of if they're paper or an electronic format, how to move documents, who's looking at them when I move them, why, what are they doing with them, and then also how should I properly dispose of documents in electronic or paper format. So to begin, the red flag rule is effective December 31, 2010, requires organizations extending payment terms to customers that have personal information on file to create a written program that identifies where personal customer information is vulnerable to unauthorized access or where the organization is vulnerable to ID theft. You're also responsible to institute precautions that address those ID theft vulnerabilities and train employees to comply with those precautions. You're asked to intervene, alert authorities, and warn the potential victims when there is a threat of ID theft. You're also asked to have a program controlling ID theft vulnerabilities signed by the board of directors of the company owners annually. Require audits of data-related vendors with access to personal information pertaining to your clients.
The Red Flags rule explains how to develop, implement, and administer an identity theft prevention program. Program must include 4 basic elements that create a framework to deal with the threat of identity theft. Programs need to include reasonable policies and procedures to identify the red flags of identity theft that may occur in your day-to-day operations. Programs must be designed to detect the red flags you've identified. For example, If you have identified fake IDs as a red flag, you must have procedures to detect possible fake, forged, or altered identification. Programs are required to spell out appropriate actions you'll take when you detect red flags. A program must detail how you'll keep it current to reflect new threats. It's very important that you understand the Federal Trade Commission is in charge of enforcing the law and estimates that 11 million organizations are legally required to comply. That is close to 40% of all U.S. businesses. So, as we move on, how should I keep my documents secure regardless if they are in paper or electronic format? When in paper format, and most of you have converted to electronic health records, and therefore you've got old records stored in-house, we suggest that you store off-site. You can safely store your documents in a secure facility where you have easy access to your inventory online. You can actually manage your records online, and you limit access to the people that you want to have access.
So through electronic format with the intention that documents are secured through the entire process from beginning inception of the information being collected, maybe on a data sheet, anything even driven through like your EMR, just making sure that that information as it's gathered is in some kind of encrypted and auditable as well as trackable area. We want to make sure that the information that's gathered is kept and secure, even if it's in electronic format. Paper is actually one of the greatest indicators of ID theft that exists, in businesses today, especially in medical practices. You could have a patient handing a piece of information on a paper form across the front desk, and have the next patient walk up and they're seeing that information. So an auditable and trackable area will be able to, whether it's within your EMR or another document management software and system, will allow you to prove who looked at the information, when they looked at it, and then what they did with it. Next section for us, how should I move documents and who is looking at them when I move them?
So you can retrieve your documents via a secure web-based application. All activity is tracked through an administration functions. There are levels of security. Access is managed by the administrator on the account. This way, your documents are off-site and protected at all times.
So one of the ways that you can track printed documents, especially in an area that is a mix of medical and maybe other business activity, is to send documents to be released at the printing device, whether it's a large multifunction copier or something like that. But what you want to be able to do is print a document and then have it released to the person who printed it, rather than having it print and then sit on a copier or printer for whomever to walk up to it and then be able to see kind of what's there, whether it's patient information or something else. It gives us kind of one more step in guiding that compliance through to the tracking and auditability of who's looking at a document and when. From an electronic format perspective, electronically programs have the ability to track usage and access to the document through typically a username and password. All that stuff is reportable. So when you're looking at something maybe potentially after a breach has happened, you can tell really who looked at it, what they did after they've looked at it with the document, and then potentially even any malicious activity that they've had. You'd be able to track that. Maybe your practice policy or identified red flag is that you are not to print any documentation that has patient information on it at all. Systems can be set with permissions based all the way to the document level, where a username and password would be required in order to mandate those rules that you set in place. Should you decide to keep documents and information in an electronic format, not only is it trackable and auditable through document management software, it also provides administration with the information, who needed it, what they did with it, and specifically, how they use that information potentially to commit a breach.
Our next is, how should I properly dispose of my documents in electronic and paper format? With a paper format, we strongly suggest a secure shredding program. You can alleviate the labor costs and noise associated with shredding documents in-house and the ongoing costs of purchasing shredding machines that jam and burn out. You're provided with a certificate of destruction for your records of compliance. HIPAA does require that you properly dispose of your documents, and then you have proof of that destruction. They also require that you have a plan in place, and this falls all back into the red flags rule that as part of your plan to protect the identities of your patients. All shredded material stays locked indoors from the time of pickup until it's received by the paper mill. All shredded material is commingled, compacted into bales, and shipped direct to the paper mill where it is recycled.
So back to AOS, and in an electronic format, retention schedules can be set to automatically remove documentation or information for either archival purposes or actually deletion. Those retention dates are set with the Now Electronic information, very, very similar to some shred dates and things like that that DocuVault will use. However, if it's in electronic format, it becomes easier to destroy, all the way down to some electronic hard drive destruction that's available on the market today. So really, once the documents are in electronic format, the best ways to dispose of them are really to have them in encrypted and or auditable databases, be it an EMR, be it a document management software that manages workflow, and then once they've been removed from that, the data can be wiped. But the absolute most secure way is to put that drive through some form of electronic data destruction. So Dawn, at this time, we're ready to kind of take some Q&A. It's a little bit of a short presentation today, hoping to give everyone some really good ideas and things to kind of digest. But if there's kind of open forum right now for questions and answers, we'd like to be able to answer them.
Okay, everyone, please put your questions in the question box so that we can get to your questions as they come in. So far, guys, the questions that are coming in asking if they can get a copy of the presentation, which, yes, I will be emailing a copy of the presentation to all attendees by the end of this week, probably by the end of today. So we'll just give it a minute or two and wait for questions to come in.
Yeah, Dawn, while we're waiting, also, I provided her with some additional information on the red flags rules, a little bit more detailed about the law and how to develop a plan. So Dawn will be emailing that to you as well.
Okay, folks, if there's no questions, we're going to close the webinar, and I'll get the presentations out to you.
Thank you, everyone. I appreciate the time for our presentation today, and certainly contact information is going to be within the presentation that's sent out. If you'd like, feel free to reach out. Rowan or I'd be able to help you.
Thank you, everyone. Have a good day.